We are in no way putting the Institute of Medicine report and the adoption of those recommendations behind us. We are still working on that. That is still front and center, very, very important. In fact, I will make the case that to be a great builder of a culture of health, you must have the basis of those IOM recommendations behind you to keep advancing education, ensuring the diversity of our workforce, making sure that we have the leadership capacity to work beside important people in our communities who are also looking to build a culture of health. So this is not an either or. This is a broadening of all of our perspectives around our role in keeping America healthy. But in being a business and looking at the return on investment, we too have noticed that the indicators in this country are not shifting in a way, the healthcare indicators, health and healthcare indicators, are not shifting in a way that would reflect the amount of money that we are spending, not only as a country, government entities, and our foundation as well. We have a much more diverse population. We have older and sicker people all of the time, even though they're not staying in our acute care facilities so long. This is it, guys. We've been hearing, even when we were in school, about the care across the continuum. Now it's critical. Now everybody has got to be working with one another. If we're going to be serious about our role, that's what we're here to talk about, our role in keeping America healthy, nurses' role. We are spending like crazy, and every new presidential campaign and senatorial campaign that comes about always talks about cutting costs, but you know, we just keep going this way. And we want to take care of our people, and the costs go up for not always good reason, because we know we give overcare. So, you know, there's disparities, right? So there's a lot of undercare, there's a lot of overcare, but certainly not equitable when we talk about health equity. And for all of the money that we spend in this country, you know, we're not first or second or third or any of that beginning lineup when it comes to morbidity and mortality. A third of our kids are either overweight or obese. 75% of 17 to 24-year-olds are ineligible to serve in the military. And that has to do with their weight. You have to be sort of in decent shape to be in the military, right? 1 of every 2 deaths in America is linked to chronic disease. That one we know. And we know that there are least healthy counties, counties as a whole that are not doing so well, and there are more healthy counties. Least healthy county is a place where more infants die, more children live in poverty, higher crime, higher unemployment, higher dropout. But in healthy counties, there is better access to not only food and parks and exercise, but health care. In most healthy counties, you're less likely to end up in a hospital for preventive reasons, because the culture is around prevention, there are fairs, people care for one another, you know, mammograms, mobile vans, and the like. There are more things that really affect a person's health than just being in the 4 walls of a doctor's office or a nurse practitioner's office or a great health care facility. You know that. It is about food. It is about the safety of your neighborhood. It is about the trauma that you are incurring as an individual. Mental health, your education level, the color of your skin, where you live. All of those things have to do with your health status in this country, and that's what we're talking about when we talk about equity. And the choices that we make are based on the choices that we have. If we're living in an area where we don't have the choices to be healthy, there's not a grocery store with fresh fruit, there is not a place to go if I'm not feeling well, that really counts for your health status. There are many people, as I said, who are interested in keeping their communities healthy and keeping America healthy. But if nurses are not there, then we will have missed an enormous opportunity. We are there to promote prevention and wellness, ensure clean water and environmental safety, depends on where you're working, and provide population-focused service to entire communities. No matter what kind of nurse you are in this country, you can be thinking, I'm a nurse. I'm here to do this job, but I'm here to think broadly about the health of my community.